Welcome to Good Morning Oakcrest, your exclusive daily morning show, bringing you Oakcrest news and information. It is Thursday, February 28th. Well, join us for the morning show as we bring you a very interesting topic and discussion about living with varicose and spider veins. In a little bit, we welcome Dr. Lakhanpal, who will discuss how the Center for Vein Restoration helps patients who suffer from venous insufficiency. Very heavy topic, and I hope that you enjoy it. That's all happening today in just a few moments. Right now, we get our 3-day weather look for today and the next few days. Christopher Tatus has the latest, and it's Thursday, so we will also have OC video. Make sure you stay close as Good Morning Oakcrest starts now.
Good morning, Oakcrest. I'm Chris Tatus in the WOCV Weather Center with your weather update for the day. Well, we saw some early morning showers this morning roll through the area, and a good chance says we're going to see some more showers as we make our way into the afternoon. But could it turn into snow? Well, we'll talk about that in just a little bit. First, let's take a look at the current radar here in the Baltimore area. Taking a look behind me at our current radar, you can see we do have some snow showers currently making their way towards the Baltimore area right now. These storms over here are the one that actually made their way off through earlier this morning and are now making their way off the coast. But like I said, these storms are the ones that we're worried about for later this evening. What's happening is right now these are passing over the Appalachian Mountains, and as they make their way into lower altitude areas, as they make their way closer and closer to Baltimore, we could see that snow change over to freezing rain and then eventually rain as it makes its way closer and closer to the coast. So right now it does look like these are going to be rain showers, but there is still the possibility that we could see a wintry mix make its way through the area later this evening if the temperatures get cold enough. We'll talk about just how cold it's going to get shortly, though. Right now, let's take a look outside Town Center and find out what's going on right now by checking our current conditions. Right now, outside Town Center, current temperature stands at 42 degrees. Taking a look at our 3-day forecast, you can see that we're definitely starting to warm up. 48 degrees is the estimated high for today. We're expecting partly cloudy skies throughout most of the day today. As we make our way into the afternoon, we could see the cloud cover pick up, turning into cloudy skies, giving us a 50% chance of rain. High temperatures today, like I said, going to be around 50 degrees, and there's going to be a west wind of about 10 to 15 miles per hour. As we get into the evening, mostly cloudy skies with a slight chance of rain, probably about 20%. And as we get into the overnight hours of midnight, what we're looking at is for those clouds to kind of clear up a little bit, leaving us with partly cloudy skies once we get past 12 o'clock. Lows are estimated tonight to be in the lower 30s. For Friday, partly sunny skies in the morning, becoming mostly cloudy in the afternoon. Those clouds are going to bring along with it the chance of sprinkles or flurries in the afternoon. Highs are going to be in the mid-40s. Northwest winds at about 10 to 15 miles per hour, but we could see gusts get all the way up to 30. For Friday night, mostly cloudy skies expected with lows around 30 degrees. Northwest winds are going to be around 10 miles per hour, and as we make our way into Saturday, partly sunny skies expected in the morning, becoming mostly cloudy in the afternoon. Highs are going to be in the lower 40s. Northwest winds expected to be about 10 to 15 miles per hour. And as we make our way into Saturday night, mostly cloudy skies with lows in the upper 20s. So it looks like Saturday and Sunday will be a little cooler, but right now it looks like they will remain precipitation free. Monday looks to stay that way as well. So it looks like we should have a nice couple of days in store for us once the precipitation from today and possibly tomorrow morning kind of move out of the area. Well, that's all for me for today. Thank you so much for tuning in, Oakcrest. Once again, my name is Chris Tatus. Have a great day, and we'll see you back here tomorrow.
Good morning, Oakcrest. Peg Leary here with your movie of the week, The Sting. The Sting stars Paul Newman and Robert Redford as two con men of the 1930s. After a friend is killed by the mob, they try to get even by attempting to pull off the ultimate sting. No one is to be trusted as the twist unfolds, leading up to one of the greatest double crosses in movie history. This is quite a team. The con is on. The movie is The Sting. Now you can rent this from OC Video for only $1 and keep it for 5 days. That's up to you. See you at OC Video. Maybe you'll find some others you liked as well.
I'm Tamika Harris, and welcome back to Good Morning Oakcrest. The Center for Vein Restoration, or CVR, specializes in venous insufficiency and the treatment of varicose and spider veins. Joining me today is founding president and CEO, Dr. Sanjeev Lakhanpal, who is board certified in general surgery, cardiovascular, and thoracic surgery. Dr. Lakhanpal, welcome to the morning show.
Thank you, Tamika.
You know, many older adults experience leg pain, severe wounds, and unsightly veins. How does CVR come to their rescue?
You know, when somebody has simple, achy, tired, heavy legs, restless legs all the time, if we go through the history of people suffering from these kind of symptoms, usually we've just ascribed it to, hey, you're getting old, so just live with it. But as we are all now demanding that, you know, what used to be 70-year-old earlier is now almost a 50-year-old, and we're all demanding to live a healthy life as we age, each one of these symptoms, we are looking at it individually and saying, okay, if you have achy legs, you're not just old, there's got to be a reason for that. And in looking so, we found that a very common reason for these symptoms that I mentioned, achy, tired, heavy legs, restless legs, is blood not being able to go back to the heart from the legs. And this blood then collects in the area of the leg, not blood per se, but fluid collects there, and it really leads to heavier legs. And that's the symptom that we are having.
You have a chart, if you want to show that right now, of blood flow and valvular function.
Absolutely.
Tell us more about the blood flow as we look at this.
So now the next step comes is that all these veins have valves in them. So imagine blood going from the heart to the tip of your toe. Now there is no heart down there that can push blood back to your heart, and the blood has to come against gravity. So what nature has given us are tiny little valves, which you will see in that diagram, that once the column of blood goes from point A to point B, the valve shuts down. It's a unidirectional valve, and then with the calf muscle pump, blood can only go back up to the heart. However, as we mature in age, and for some of us even earlier on based on our genetic makeup, our vein walls dilate and these valves stop working. So with that, blood seeps back by gravity to the feet and causes the symptoms that we talked about.
Thus we have the squiggly veins.
And that's another consequence of that is that, so now we have a much higher back pressure, so to say, in our normal veins, which in trying to hold that extra blood, make it a squiggly vein.
Right. So that's
see.
varicose veins, spider veins, different venous insufficiencies.
So it's really, you know, vascular surgery is so similar in its own ways to plumbing.
Really?
That you've got, think of this, so now you've got all this back pressure building at every level. So whether we have the varicose veins in the bigger veins or the spider veins in the tiny veins, it's all basically back pressure building up.
So you're a plumber by trade.
Absolutely.
Let's talk about CVR, the Center for Vein Restoration. This is your baby. This is something that you created, and there are not a lot of these vein restoration companies at all, really. Talk to us about when you started creating CVR and why you did it.
You know, it's been a very, very fascinating journey with CVR. First of all, we'd like to call it a practice, not a company.
Okay.
But as our main business is taking care of patients, just like any other medical practice. And really, this was no grand plan that we created this by. We just felt a huge need that our patients had. as a cardiac surgeon, what I would see is at times we would take the vein from the leg for a patient to put on his heart bypasses.
Wow.
But especially when a couple of times we noticed that the vein was not usable, we had to throw that vein away. But the patients came back and said, hey, doc, my leg feels so much better. I don't know, whatever you did. And in trying to add 2 and 2 up, we figured out that, hey, this was actually, we've just treated the vein which needed to be treated, and the patient is feeling so much better. So exploring that further, we realized that the technology had improved. So now treatment of varicose veins is nothing new. This has been going on for centuries. However, the technologies that can make this happen in 15 minutes, so a nurse going to work in the morning can stop in our office at 6 a.m., get the treatments done, and at 7 a.m. be at work for a full day's worth of work.
That's phenomenal.
That is really what has changed and what's helped us provide treatment for a need that has always been there.
Before the show started, you gave me differentiation rather about your work, that it is, you specialize in symptom treating versus cosmetic treating. What do you mean by that? Because I think a lot of us hear the commercials, got spider veins, got varicose veins, come on in, we'll get rid of them. But you do more than just that.
You know, you're absolutely right. What we pride ourselves in is, again, we really respect the cosmetic side of treatments also. However, when a patient really has symptomatic venous insufficiency, that is what we feel we can treat very effectively. And in fact, you know, these symptoms that I was telling you about, the achy, tired, heavy legs, restless legs, if a patient comes in and is diagnosed to have these symptoms due to venous insufficiency, and they go through the treatments, chances are upwards of 97% that next day their achy, tired, heavy legs will be gone. I mean, that's how effective these treatments are in that specific subset of patients.
So are we talking about blood, or are we talking about fluid that makes the legs heavy, bloated looking, swollen looking? Are we talking about blood or fluid?
It's fluid. It's fluid that oozes out of the blood. See, now the blood has red blood cells, white blood cells, plasma, all these things. Now, as the vein walls dilate and they try to hold more blood than what they're used to, the blood cells themselves cannot seep out, but it's the fluid that seeps out of that membrane. So I think you very aptly pointed out, it's not really blood that collects down there, but it's the fluid component of the blood that seeps out and collects over there.
All right, so you have another chart here. We're going to show it. It's grades of venous disease. And some of these images look very familiar to the senior population. And so, you know, explain what we're looking at here. You have CEAP, which is a grade, I guess, of venous insufficiency.
Yeah, this is what is classification of venous insufficiency as to, on a scale from 1 to 6, how bad is somebody's venous disease. So if you look at CEAP1, now CEAP is a fancy name for, it's clinical, etiological, pathological, you know, and anatomical. So it's basically classifying how bad is your venous disease. CEAP1 is when somebody has just spider veins or reticular veins.
So that's more of a surface.
That's surface stuff. Now, when somebody has CEAP1, that is just spider or reticular veins, it could be purely cosmetic, so there are no symptoms attached to it. However, a patient could have severe itching, some burning, and most importantly, bleeding. A lot of ladies would have big reticular veins, and if they are shaving, they could run into significant bleeding. Now, one thing I would like your audience to know about is if somebody does get into a bleeding situation with a vein, not an artery, and arteries are what take blood away from the heart. That blood is under a lot of pressure, about 80 to 120 millimeters of mercury. Veins are what take blood back to the heart. Blood in a vein is typically not under a lot of pressure. And if somebody runs into a bleeding situation from a vein, all that they need to do is lie down and elevate their leg.
Okay.
Call, depending on how bad the bleeding is,
Okay.
call for medical help. But the moment you elevate your leg, bleeding will stop.
Okay.
Unfortunately, a lot of our patients are not educated on that. We've got patients who come in who've really bled more than a liter just from a little venous bleed.
My goodness.
But because people, when you see all this blood around you, you get anxious and you start doing things which hurt even more.
Right.
But that's the one lesson I would like to take out of that SEEP1.
So that's SEEP1.
Then let's go to SEEP2.
Yeah.
SEEP2 is what we classically call varicose veins. Okay, so you see that ropey vein right there? It is very obvious. In the whole scheme of things, it's an early form of venous disease. SEEP2 is or can be associated with the symptoms. Achy, tired, heavy legs, restless legs, and all those things. Now, whenever a patient is symptomatic, whether it's SEEP1 or any other stage, your insurance company, including Medicare, pays for the treatments.
Oh, okay.
If you are not symptomatic, appropriately so, the insurance companies do not reimburse for treatments, and if a patient goes for cosmetic treatment, they have to pay out of pocket. It's, again, very simple to treat SEEP1, SEEP2. SEEP2, in association with the treatments we do, we also treat patients with something called a phlebectomy, where that ropey vein, we just take it out. It's again an outpatient procedure, takes 20 minutes.
Phlebectomy.
It's called a phlebectomy. And once it's gone, then all the subsequent complications or potential complications of this ropey vein are gone.
So let's go all the way to SEEP6 if you don't mind, because that to me looks like very damaged situation. Do you have patients who wait until the skin color changes and everything before they come to see you?
You will be shocked to find
Really?
out how many patients.
I mean, because SEEP6
I am
is,
ashamed to tell you, even some physicians have come to us with SEEP6, with
SEEP6
ulcers.
looks like it's almost, you have to cut that off, right?
No. The good news is all this is treatable.
Really?
Yeah, unless with SEEP6 you've got infection going down to the bone. The really good news is that this is treatable. In fact, our practice has published one of the largest series of SEEP6 patients in the country, which have been treated just with these outpatient procedures. These patients do require a fair amount of outpatient procedures. They also need to work with a wound center.
Right.
But this is the whole disease process
So tell us
can
about
be treated.
SEEP6 folks. What is going on to make the skin color change and all of that?
Okay, if we bring that slide back up.
Yeah.
Before we go to SEEP6, let's quickly touch on SEEP3, which is swelling.
Sure.
So now think of the whole continuum again. Blood is backing up in the veins. First part, the tiniest veins are showing up in SEEP1, spider reticular. SEEP2, the next level veins are showing up. SEEP3, still plumbing, blood backing up. You've now got edema, which is swelling.
Okay.
So you got so much fluid oozing out.
And we can see that in that
That's
third
right.
picture on the top.
In the third
one leg
picture,
is a
exactly.
lot bigger
That's
than
what
the
it
other.
shows, that one leg is normal and one leg shows swelling. Now, what happens when you've got this extra fluid in your leg is that the normal nutrients which blood brings to the tissues are not getting there. So that's how we get into the next stage, where all of a sudden from swelling, now we've got kind of fibrosis, that the leg shrinks down and there is more scar tissue formation in the leg.
distorted a little.
There's more scar tissue formation. And the color starts changing. Because earlier, as I told you, it's only the fluid that is going out. Now the red cells start breaking down and their pigment also starts going out. And that pigment causes the change in the skin coloration.
Wow.
From there, the next stage is actually from 4, it goes to 6, because now the skin, the subcutaneous tissue is not getting the nutrients, and it all breaks down.
So it's decaying.
It's absolutely. It just totally, it dies. That part of the skin, subcutaneous tissue dies to form the ulcer.
And that leaves folks open for wounds, diseases.
That's right. Yes. That's serious. That is serious. Right. Fortunately, in most cases, treatable, but it is serious. And once we can heal that with great amount of wound care, with compression, with the treatments, then you go to the SEEP5, which is just nothing but a healed ulcer.
That's fantastic. If you're just joining me, I'm speaking with Dr. Sanjeev Lakhanpal, who is board certified in general surgery, cardiovascular, and thoracic surgery. He is here today from the Center for Vein Restoration, and we'll shorten it as CVR. And it's a practice that actually you have a variety of practices in this area. You know, we're talking about venous insufficiency, spider veins, varicose veins, and we thought that it was very important to bring this information to Oakcrest. You service a lot of clients in our residents' age range anyway. So, you know, this is really almost like a partnership, if you will, of information that you're bringing to us, and we so appreciate that. Now, I want to talk about varicose veins and spider veins. First of all, I'm asking this from a personal standpoint. Is it hereditary? My grandmother has varicose veins. So, you know, would I be one to say, you know, be on the lookout for this as I get older?
Well, I'd love to say no, it is not, but unfortunately it is.
Really?
Yes, but there's a lot you can do to prevent the ravages of that. So we get a lot of patients, a lot of younger people like yourself who are very concerned that my grandmother, her legs looked like this, this, and this. Yes, you do have a higher preponderance of getting varicose veins, spider veins. But if you take care of yourself, going through life, exercise, eat right.
So exercising does matter.
Exercising helps everything. Okay.
Okay.
So it absolutely helps. However, when ladies go through pregnancy, they will have the hormones that your veins are exposed to at that time will lead to a higher incidence of varicose and spider veins in people who have family history of varicose and spider veins.
So what about male and female ratio? Do women get varicose and spider veins more than men? Or are you seeing both genders?
Women do get more, but women also notice them more. We'll have a lot of men walk in and, they come with their wives and they have this ropey vein and they don't even know about it. When you ask them about the symptoms, that's when they would say yes. But in short, this affects women to about the tune of 75% and 25% of men. And the primary reason for the difference is, again, the hormones that women are exposed to during pregnancy.
When you're talking about doing surgery for venous disparities, other venous diseases, what is the surgery like? I mean, because veins are, underneath the surface. So do you have to pull back skin? Do you have to, what is the surgery like?
It's not even, the word surgery does not do justice to what we do.
Okay.
It's really a procedure is what we call it. It's an outpatient procedure. It's almost like starting an IV line when somebody goes to the hospital. So we access that vein. The beauty of the advances in technology are such that we can access that vein under ultrasound guidance. And I could actually send you a little video of that. Wow. if your audience would like. So under ultrasound guidance, we access that vein, pass a little catheter through a very tiny tube, and that's basically the procedure.
Is there any vein that you cannot operate on?
All the veins that we need to operate on for this, they are accessible. Okay. There are certain, another component of this is that somebody may have deep venous disease. So this is all superficial veins. those are treated very differently. A lot of your audience may have heard of deep venous thrombosis. Even though that is an element of venous disease, it's related to what we are doing, but it's a whole different disease entity than what we're talking about
So
today.
do you call this vein stripping?
No. Vein stripping is what this used to be called. The older method, when I told you that this has been done for decades and
Yes.
almost centuries, was vein stripping. Now with the newer advances, we do not have to put people through vein stripping. We just do it. This is called vein ablation. It's called an
Okay.
ultrasound guided access, and then subsequently we treat the vein by ablating it either with laser therapy or with radiofrequency.
What is it about, if somebody's looking at this conversation right now and it's, kind of inspiring them to look into it further, what would you say is the first step that they should take?
The first step absolutely is they need to talk to their primary doctor, whoever, and you told me earlier in educating me about Oak Crest as to how well you take care of your residents here by providing them on-site medical care. So they need to bring that up with their nurse, with their primary physician who may be visiting here, who can then get in touch with us. If for some reason when the patients can self-diagnose this a lot also, and we'd be very happy if they call us directly. Then we can reach out to their primary care doctors and get the whole thing facilitated.
Okay, awesome.
So that it's key that we address this issue in partnership with the doctors who are going to take care of them or the clinical providers for the long run. So everybody getting the information that this is what we are doing on Mrs. Smith is critical for the continuity of care that your
Open
patients need.
communication between all doctors.
Yes.
Now, is there any way to prevent venous insufficiency like spider veins and varicose veins?
We can prevent the onset of symptoms, or we can delay the onset of symptoms by using compression stockings. Compression stockings are very, very helpful in this whole disease entity.
And starting to wear those around what age?
I'd say, especially around pregnancy time and all. So
Okay.
when at the age group when young ladies are thinking of, going the family way, I think it'll be, especially if you know that your mother, your grandmother had significant venous insufficiency. Now, in the winter months, that's easy. Okay, because you can get these compression stockings in different shapes, sizes, fashion. It's just the whole gamut is phenomenal these days.
They're a lot discreet now than they used to be, right?
In the summer months, it's a big deal.
Okay.
Because especially, when they start impeding your lifestyle when it's so hot and you have to put these stockings on. So what I always tell our patients is that the more you can wear them, the better. If you know that you have this disease entity in your family, the more you can use compression stockings, the better.
So is that really the only method of prevention?
Other than the things we talked about, which is
Yeah.
taking care of your weight and eating the right diet. With obesity, there is clearly a higher incidence of venous insufficiency.
Because your blood,
So,
your
yes.
veins everything has to work harder.
Yeah,
Right.
there's a lot of medicines that have been mentioned out there, but I'm not aware of any FDA-approved medicine that has helped with this. Over the counter, I dare say I would want people not to waste their money at this stage. Hopefully soon we will have something which is approved by the FDA and which is definitely proven to be useful, but there's no such medicine at this time.
Got you. Well, what about vascular exams? You do those at CVR?
Oh, absolutely. At CVR, what we do is we do a whole gamut of, your vascular health. So we are a cardiovascular practice which takes care of from the heart to blood vessels to the veins, and that's how we test the entire cardiovascular
That's wonderful
system.
because you
So-
do continuum of care of
Exactly.
the entire thing. You're not just saying, oh, let's just look at the veins.
Absolutely.
Looking at the heart and, some folks may even be wondering, well, what are some unqualifying factors for considering vein surgery or vein procedure? Are there any diseases that would prevent someone or physical ailments that would prevent someone from getting this procedure done?
You know, again, that's a very, very important part of the decision-making process.
Okay.
That does this patient fall into a category where some kind of treatment would actually hurt the patient than help the patient?
Right, because you have blood clotting that
Absolutely.
would be very important.
And that's where somebody having deep venous thrombosis is a critical component of the decision making. So now think of this again. Let's go back to the plumbing analogy.
Sure.
That you've got blood going back to the heart through two different pipes. One is the deep pipe, one is the superficial pipe. So if in the way we fix the leak in the superficial pipe is by shutting it down and rerouting the blood into the deep pipe. If the deep pipe is already closed, then we can't shut down the superficial pipe, right? So that's one of the absolute contraindications to the procedure, is if somebody has coexisting deep venous thrombosis at the same time.
Well, I'm sure some folks want to call and get some more information about what you're doing at the Center for Vein Restoration. Why don't we give them the phone number now?
Sure. I think the number is a very easy number. It's 1-800-FIX-LEGS, FIXLEGS.
I love that.
That's what we love to do, and give us a call anytime.
Wonderful. Well, again, that's 1-800-FIX-LEGS. You can speak to the folks at the Center for Vein Restoration. You can speak to Dr. Lakhanpal's wonderful staff there. And you have different locations around this area in particular.
We have 21 locations
Wow.
in Maryland, D.C., and Virginia. And again, the primary reason to have so many locations is this is a quality of life issue. Okay, and a lot of our patients, we do not want them to travel 40 miles in traffic. And this is such a simple procedure that we can really do it in your neighborhood, so to say. And consequently, and as you were educating me earlier about where all your centers are, I think all of those centers, including the ones in Virginia, Northern Virginia, you have centers there. You said you have one in Silver Spring. You have one right here where we are, next to Baltimore, Towson area. We've got centers just surrounding all of these areas,
Great.
which would be very happy to treat your patients.
And not only are you doing your work here in the United States, but also back home, India.
Absolutely.
That's
we
fantastic.
have some centers in India that we've opened. We have a center in China. And again, it's the need for this is so huge anywhere in the world.
Wow.
That if today you were to say, hey, I want to go to Malaysia and do this there, I can guarantee you that